Well, hello, and thank you for joining our webinar specifically on the upcoming changes to the Medicare prescription drug health plan market. Today, we're going to give you a behind the curtain look of the impact of the Inflation Reduction Act. Now, we saw some major improvements to Medicare prescription drug plans overall, but you need to understand those changes and how it's going to impact you significantly. Just quickly, I'll give myself a brief introduction. My name is Ryan Murchie. I'm the owner and principal of Health Plan Helpers, and I've been in the Medicare industry now for over 15 years. This is what I've done throughout my entire professional career. We get the opportunity to change with Medicare as well, and that's one thing with federal health plans and federally regulated products. The one thing we can guarantee is change. Now, one thing I want you to remember about this specific legislation is it's the Inflation Reduction Act. So it's specifically designed to lower the cost to the federal government to try to slow down the pace of inflation. And so what we're going to see and what you're going to see is that the federal government's responsibility for the cost of Medicare eligible drugs has significantly decreased. And that was the overall goal of this legislation. Now, I am going to be going through this information pretty quickly. So if you have any questions, any concerns, please call our office. You see right there, our phone number is 720-782-2340. Feel free at any time of this presentation to just say, you know what, this is too much. I want to talk to an expert. I want to sit down with someone local to help me, and go ahead and call that phone number. You can also go on our website, healthplanhelpers.com. And on that website, obviously, we'll have more information, but also it will have a local agent locator tool. So you're going to be able to type in your zip code and find a local agent that's an expert in Medicare health plans, and they will help you navigate this from across your kitchen table. So please keep that in mind. So we are going to go ahead and start getting through the information here. Again, if you have any questions, please write those down and call our office after you watch this presentation so we can go ahead and get you up to speed on anything that you may have questions on. So going ahead and moving forward here. Now, the goal of this presentation is not to scare you in any way. Okay, we just need to simply educate you to make sure that you understand the changes and how they're actually going to impact your healthcare coverages. So please don't be scared by this. There will be some changes. This may negatively impact you if you don't have a huge cost of out-of-pocket drugs, but a lot of positive changes. So please keep that in mind as we go through it. The first thing we want to talk about is the cost shifting. Okay. Now, we did the biggest thing in 2025 that we saw and is going to help a significant amount of our Medicare eligible population is that in 2025, they put a $2,000 cap on your out-of-pocket prescription drug spend. So that's great news. Okay, that is great news. You no longer, once you hit $2,000 out of your own pocket in copays and deductibles on your prescription drugs, you now have, that's your cap. You won't have any additional out-of-pocket spending on those medications. So that's great. But what we have to understand here is the cost shift that occurred after this legislation went into effect. And what you're going to see is the Part D plans. I'm not sure if you can see my mouse, but the Part D plans in 2025 are now responsible for 60% of all the prescription drug costs after that $2,000 threshold. Now, before, in 2024, what you'll see is this dark blue. Now, this dark blue is original Medicare itself, so our federal government. Back in 2024, once you got through the coverage gap or the donut hole, which no more donut hole for 2025, great news there. But once you got through that donut hole, the federal government actually picked up 80% of the cost of those medications. Now, that was a huge bill, huge bill. And so we had to do some cost shifting in order, again, to reduce the inflation, which was the overall goal of the federal government. You have to reduce spending so you can reduce inflation. So what we saw in 2025 was the federal government go from 80% of those drugs to only 20%, okay? The biggest problem with this is that the government had to shift all of the additional expenses back onto the insurance companies and the drug manufacturers. Now, unfortunately, insurance companies can't just eat this cost. They can't just say, oh, yeah, we got it, no worries, we We won't pass it on to the consumers. We know that that's not the case. Insurance companies have to maintain profitability in order to maintain insurance products in the market. And it's very important that we have insurance products in the market. So what we saw and what you're going to see in 2025 is, due to this massive change in the insurance companies now being responsible for a significantly higher tab at the end of the year, they have to shift that cost onto the consumer or the insured, and that is you. So we have to understand that and the changes that are going to occur because of that. Okay, but before we get into that, we just want to show you a little timeline of cost shifting. So this has been going on for the last 3 years. Okay, in 2023, we saw Part D vaccine coverage expanded. So we saw additional vaccines being covered through your prescription drug health insurance on original Medicare. We also saw an excellent program called the Insulin Savings Program, and that capped the cost of insulin to $35, which was a huge godsend for a huge majority of our diabetic individuals. In 2024, we actually saw the catastrophic coverage cost share. So after you got out of the donut hole, we used to have to spend 5% on all the costs of our drugs. We'd have to still cover 5% of that. In 2024, they got rid of that. So once you hit catastrophic coverage, you were no longer responsible for any share of cost, as long as your drugs were on the formulary and they were medically necessary. Okay, but in 2025, we're seeing a massive shift. And the reason why we wanted to explain where the cost shift occurred before this was because this is really nice, right? We see a $2,000 maximum out of pocket on our prescription drug insurance. We may have been spending $6,000, $7,000 a year in years past. We see $2,000 and we're super excited, okay? Which we should be. That's great. We now have a $2,000 cap on our prescription drug health plan spending. The only problem with that, again, though, is the federal government shifted the majority of the cost there back onto the insurance company, and they took a step back. They went from 80% to 20%, and the insurance company went to 60%. Okay, so unfortunately, the insurance company has to pass that through to the insured. So we're going to see some changes in prescription drug coverage overall, and we're going to talk about those today and what for you to expect. Okay. Reading your annual notice of change letters this year is going to be extremely important, okay? And we're going to talk about that a little bit more. I am going to go ahead and jump over this slide. The true out-of-pocket cost is extremely confusing. We can go through this with you individually, but really these two slides, what it's explaining to you is you very well may not spend actually $2,000 out of your own pocket. It may be much less than that. Now, the nice thing about working with an independent broker is that we're going to be able to plug your medications into an all-in-one quoting tool and give you a very close estimated annual out-of-pocket drug expense. And we actually do that at no cost. Okay, so again, at any time during this presentation, please feel free to call the Health Plan Helper's office and schedule an appointment one-on-one so we can go through this with you individually. But here is our 2025 Part D minimum standard. And what that means is that the federal government is requiring each individual insurance company that offers Medicare prescription drug health plans to meet at least this standard. So in 2025, the maximum deductible a prescription drug health plan can have is $590. The maximum cost share amount that one of these prescription drug health plans can have is a 25% coinsurance. Okay, and then the maximum out of pocket is $2,000. Okay, so if you spend your $590 deductible, you'll have a 25% cost share on the drugs up to the $2,000 cap. Now remember, this is the minimum. So many insurance companies are going to do a lot better than this, and that's something we can absolutely help you identify. So we want to talk a little bit. We know the cost shift. The insurance companies are now responsible for the vast majority of this tab, which they have to pass on to the consumers to maintain profitability. Okay, it's just the industry that we're in. The insurance companies have to maintain profitability. They can't go bankrupt, because if our insurance companies go bankrupt, then what do? We don't have any insurance at all. And so unfortunately, the insurance companies have to pass a large share of this cost on to you. And so we want to kind of explain the differences. Our Medicare Advantage products with a built-in prescription drug plan, so we call these MAPDs, they are going to be less impacted. And the reason being is because they can spread the risk throughout their entire health plan. Okay, so we see some insurance companies with some degradation of benefits on their actual health plan to help cover some of the cost of these prescription drugs that they're now responsible for. So they're able to spread the risk throughout the entire insurance product. Now, if you're on a Medicare supplement and a standalone prescription drug plan, you will be the most impacted because the standalone prescription drug plans, the only thing that they can do is increase premiums and restrict formularies. Okay, that's all they can do. And we did see the federal government actually give us a little band-aid here. Okay, they did say, oh, I think the average standalone drug plan at one point came in at over $180. And so what the federal government did was they gave us a band-aid and they said, hey, we're going to give you an additional $50 premium subsidy to help bring down the standalone prescription drug plan premiums. Okay, because it is an election year. If everyone gets a crazy $150 increase, that is going to upset a lot of consumers. So we saw the federal government give us more or less a band-aid and a $50 premium subsidy to help bring the standalone prescription drug health plan premiums down. Okay, and so we did see the standalone drug plan premiums come down, but they are still going to be significantly higher than they were last year. Okay, and so what we can expect here is higher premiums. We can expect fewer plan choices. We're going to see some insurance companies leave the market because they just aren't able to structure their products to the point where they're going to be able to create profitability. We're going to see severely stricter formularies. And we're also going to see more drug utilization reviews. So prior authorizations, step therapies, and quantity limits. Now we are going to talk about all of these individually, so just bear with me. So let's talk about higher premiums here just for a second. So again, if you have a standalone prescription drug health plan, maybe in partnership with a Medicare supplement, you are going to be the heaviest impacted, okay? Because these insurance companies have to raise these premiums significantly. Because before, they weren't really responsible for any of the share of the cost once the client was out of the donut hole. Now, once a client hits a $2,000 cap, the insurance company is responsible for 60% of all of the medications that you take after you hit the cap. They have to just eat all of that cost. And so on a standalone drug plan, the only thing they can do is increase the premiums. Okay, so you're going to see significantly higher premiums on your standalone prescription drug products. This very well may affect our Medicare Advantage plans as well. We're really hoping our Medicare Advantage products will be able to maintain zero to low premiums. We'll be able to discuss more of that with you come October 1st when we're allowed to discuss 2025 health plan options. But we're going to see higher premiums, and they have to increase these premiums. So there's really no way around it. We saw an increase in the deductible, and I bet you most of the insurance companies that have products in the marketplace are going to have to add a deductible to their health plan. So for those of you that have been really used to really low standalone prescription drug plan premiums with really low deductibles, this is going to kind of shell shock you a little bit here in January because our premiums are going to be higher and our deductibles are going to be higher. And so we got to really take a look at this. So we're moving forward here, and we're going to talk about the formularies. Now, I really believe that this is going to be the biggest change that we really have to keep an eye on. The biggest reason being is because if the formulary changes and your drugs on the plan that you're enrolled into for 2024 are no longer covered for 2025, and you don't do your research and find a plan that is going to cover all your medications, in January, you aren't going to have prescription drug coverage on the drug. And so please, if you get anything out of this presentation, do your homework, okay? Make sure come October 1st that you check your insurance company's formulary to verify that your prescription drug plans are now, or your prescription drug plan now covers all of your RXs. Okay, that's going to be really important. So what we're going to see is a much stricter formulary, again, because the insurance companies have this huge significant bill that they've never had to pay in the past. And so for the most part, what we're going to see a lot of insurance companies do is restrict their formularies down to 2 covered drugs from each drug class. Now, there are more drug classes than you can imagine. Okay, there's 10, 20, 40, 50, 60, 70, 80 different drug classes out there. But there are only 6 protected drug classes. Okay, so if you're on any immunosuppressants because you may have had a kidney or a liver transplant, if you are on any antidepressants, antipsychotics, anticonvulsants, antiretrovirals, or anti-immunoplastics, okay, for cancer treatments, those are our protected drug class. So our formularies are going to be required from the insurance companies to carry the vast majority of those medications. But if you're on a statin, if you're on any insulins, if you're on any type of blood thinners, things of this nature, we're going to be very strict. The insurance companies are going to be very strict on which medications they cover in those tiers. Okay. So again, if you get anything out of this video, please just make sure your drugs stay on your health plan's formulary, and we can help you do that. Okay. So again, feel free to call our office come October 1st, or come, right now to set an appointment for October to verify that your drugs will still be on your health plan's formulary. Now, if it's right for you to stay on the product that you have currently, we're going to advise you to just stay where you are, because relearning a new insurance company is not always the best fit. Okay, trying to relearn a new insurance company is not always the best fit. So if we can maintain you on the same insurance product, then that's what we're going to do, because it's going to create less change for you, which in turn is going to help your healthcare overall. Okay. All right. So moving forward, so more drug utilization reviews. When I spoke on this, I didn't give you any definitions of these. And so when you see PA, ST, or QL anywhere on any materials, okay, they only use the acronyms. So you got to know what the acronyms mean. So PA means prior authorization. And what this means is that your insurance company, or your prescribing doctor, the doctor that prescribed you the medication that requires a prior authorization, needs to work with your insurance company to get them to prior authorize the use of that drug for your diagnosis. Now, this typically is a very quick process. Everything is electronic anymore. Okay, so, in the past, when I first got in the industry 15 years ago, we'd have to get a written letter from the doctor and then fax that into an insurance company. That's not the case anymore. These are all electronic records. Prior authorizations typically can be done in 12 to 24 to 48 hours at max. Okay, so again, double check your formulary, or let us help you double check your formulary to make sure that you don't have none of your drugs now require prior authorizations. We also see step therapy. And now what step therapy is maybe you're on a very expensive brand name medication. Okay, the insurance company is going to look at that and say, hey, have you tried the lower cost generic? And if you haven't, please try the lower cost generic first. And if the lower cost generic does not work, then we can step you up into that higher cost brand name medication. That's what step therapy is. So when you see ST, the letters S then T, that means step therapy, and the insurance company is going to want you to try a lower cost generic first before they cover that higher cost brand name medication. And we're also going to see a lot more QLs, or what we call quantity limits. And what that means is the insurance companies were going to restrict the amount of pills or drugs that you can get on a monthly basis. Now, we don't see this on many drugs now. Really, we only see it on our opiates or our pain management medications. But we may see this on more drugs into 2025, again, because of the huge bill the feds passed to the insurance companies. So take a look at that. Make sure if you see quantity limits in your drug plan that you're taking less than that, because it's not going to be the right fit for you to stay on the product if the drug plan is only covering 15 pills when you take 45 a month. We need to change your insurance at that point so you don't get stuck with a huge bill of non-covered medications. Okay, so just make sure that you're doing your homework here and verifying these three things, or you're working with a local broker that is going to help you do this. And again, we can simplify this all for you. We can go through it with you individually. Just go ahead and call our office. Now, a new program that the federal government actually just came up with is the Medicare prescription payment plan. Now, you're going to be hearing all about this. We're going to see advertisements for it. The federal government is going to have to run an education campaign, so we're probably going to see some educational materials directly from CMS via commercial or via social media ads or whatever it may be, to try to educate the consumers and really the pharmacists as well. The pharmacies have no idea this is going on either. It's going to be a lot of fun. Really trying to educate everybody on how the M3P or the smoothing program is going to work. And those are the two names that we've heard. Okay, so the most commonly referred to, we most commonly refer it as the M3P program. And what this is, it's a payment program. So now, not only are the insurance companies going to be required to carry a significantly larger bill, but they're also going to be required to be in the debt collection business as well. Okay, so huge shift of cost to the insurance companies, as well as a whole nother level of administrative requirements that they're going to have to go through in order to maintain this M3P program. And what this is from what we've been told so far, and we're pretty clear on all the information now, we've been researching this over the course of the last couple of months. From what we've been told so far, and this is subject to change, is in January, if your bill is more than $600, you don't have to pay that all up front. You can set up a payment plan with the insurance company to spread that out over the entire course of the year. So let's say you take one really expensive brand name medication and your share of costs for that drug in January, because of the new rules, is $2,000. We're going to see a lot of people with $2,000 out-of-pocket spends in January. But remember, you're then capped and you're done for the rest of the year. But can you afford to spend $2,000 out of your own pocket in the month of January and just stroke that check and be done for the rest of the year? If you can't, Medicare has set up this program so the insurance companies can help spread the share of that cost over 12 months. Okay, and so instead of paying $2,000, you'll pay $2,000 divided by 12 over a 12-month period. Now, if you fail to pay that bill, and we have a huge amount of Americans over the course of this year fail to pay those bills, the insurance companies again are going to have to increase costs. So I urge you, if you are setting up a smoothing program or an M3P payment program because you can't afford the full share of the cost of drugs in January, to pay those bills back. Because if you don't pay those bills back, the insurance companies are going to rack up a huge amount of debt, and they're going to have to increase premiums and decrease formularies even more come 2026. Okay? Now, again, if you have more questions on this, and if you expect that you're going to have a huge share of costs in the month of January, you have the opportunity to set this program up after October 1st. Okay? And if you know something, again, we can help you determine. This is why having a local advocate agent is going to be so important for you this year. Okay? It's just kind of stuff like this. Hey, should I call and set this up now? Because if you don't call and set this up now and you find yourself with a $2,000 bill in January, the only way to set it up in January is to call the insurance company. I don't know about you, but I am really not trusting the hold times that our insurance companies are going to have in the month of January. There's going to be thousands of Americans across the country, or thousands of Medicare eligibles across the country, trying to call these insurance companies to set up payment plans. Okay? That's going to significantly increase the hold time. So if you wait until January to set this payment program up, you very well you just need to be patient. Okay? Just keep that in mind. If you wait until January and you want to set this program up in January, it is going to require some patience, because you, as well as tens of thousands of Medicare eligibles across the country, are going to be trying to do the same thing at the same time. So great suggestion here is to work with your agent in this fourth quarter to determine whether or not you're going to be able to afford your drugs in January. And if you aren't going to be able to, set this program up well in advance, so you're not sitting on hold with the insurance company for 2-3 hours come January. Again, any questions on that, call our office. Okay? We are going to skip ahead here. Our creditable coverage slide, we were really worried about this first and foremost, because Medicare's definition of creditable coverage is that your creditable coverage has to be at least as good as Medicare's. Okay? And now that Medicare has a $2,000 cap, that was going to dramatically change the landscape. All of these individuals on employer group plans that are working past the age of 65 were no longer going to be enrolled into creditable coverage. Again, the federal government saw that and saw the massive disruption that it was going to create. And they gave us a Band-Aid. And they said, hey, if your group plan is creditable in 2024, we're going to allow that to be creditable again in 2025. And then in 2025, it'll be the next administration's problem. And so in 2020, right now, if you're on a creditable group employer plan, that will maintain its creditable status come through in 2025. But if the Band-Aid doesn't stick into 2026, we're going to see a huge amount of individuals across the country still enrolled on employer group plans need to disenroll from that because they are no longer on creditable coverage. Now, we give you the opportunity to download a full copy of the Inflation Reduction Act. Here is the QR code. If you want to go ahead and scan this QR code, the CMS.gov Inflation Reduction Act, I think it's 700, 800, 900 pages. I can't remember the exact amount of pages it is, but it's a massive legal document that was written by attorneys. But if you would like to reference a full copy of the Inflation Reduction Act, which is where we pulled all of this information out of, this is where to go ahead and locate that material. So go ahead and scan this QR code now if you would really, if you want to read a 700-page legal document. There's a few people that watch this video that are going to want to do that. And so we absolutely give you the opportunity. You know, some good light bathroom reading. All right, so the biggest thing to take away from this presentation is that you should anticipate that you're going to need a review of your product during this Medicare annual enrollment period. The Medicare annual enrollment period runs from October 1st till December 7th. If you do not have a local advocate agent that is going to sit across the kitchen table from you and make sure that your drugs stayed on formulary, make sure that you're not going to need any additional step therapy requirements on any of your medications, okay? Make sure that there isn't any quantity limits on those. Oh no, where did I go? Lost my slide, there we go. Give us a call, okay? You are going to need a review, okay? We actually saw a new study come out, published, that over 40% of all Medicare eligibles here in this country are going to have to replace their health care because of the changes within the prescription drug landscape. So it's going to be really important for you to find a local agent that is going to sit down and make sure you understand this and make sure you're enrolled into the correct health plan for 2025. So not only that your drugs are covered, but they also don't have any quantity limits, and they also don't require any step therapies. And for those of you on standalone prescription drug plans, if you don't like the premium increase that you took, we can shop other more affordable choices for you. So give us a call. Go to our website, healthplanhelpers.com. We have a ton of agents throughout the state of Colorado that will be able to sit down with you individually across the kitchen table. Just find the locator tool, put in your zip code, and you'll find bios and contact information from the local agents in your area. Or you can just call my office direct and work with my staff here at Health Plan Helpers, and we'll go ahead and help you quote this out and make this as simple as possible for you. It's very confusing, so let us make it easy for you, okay? I always like to say, as an insurance broker specializing in individual Medicare products, that I speak 2 languages. Now, a lot of our agents speak more than 2 languages, but me personally, I speak 2 languages, one of those being English and the other being health insurance, okay? There's not a lot of Americans that speak health insurance. And so find one that does, that can really help you, that has your best interests in mind and is not biased. Okay, and that's why working with an independent broker is so important, because we are not biased. We're going to shop all the health plans for you to make sure you're enrolled into the right product for you. And that's going to be super important. If you call off one of these commercials that you see on the TV, the big infomercial ads, you're going to get a call center, and that call center's advertising has been purchased by a specific insurance company that you will be steered into. Okay? If you don't want to be steered into a specific product and you just want help making an educated choice, work with one of our brokers, call our office. We will help you. Thank you so much for taking your time to better understand the changes within the prescription drug health plan marketplace. I hope you found this video informative and that you got something out of it. Call us. We're going to love to help you this AEP. We'll make this as easy as possible for you. Thank you so much.